Good morning, friends. Today I will be talking on an important aspect about medicines, and that is side effects. I get asked this question quite often. Doctor, does this medicine have any side effect? Or should I take this medicine because I am worried about side effects?
My friend tells me that these medicines have side effects, or that if you once you start them, you can't stop them.
In other words, the worry is that I may get addicted to medicines. But let's come to side effects. What are they? We all know that every movie has lead actors, right?
James Bond is the lead actor, so he has all the guns, but there are also other side actors, right? So likewise, the medicine has a main effect for which we are taking the medicine, but there are also other side effects, right? Like drowsiness, dizziness, etc. Side effects are not always bad. They are not all villains.
That's right. You heard right. Side effects are not always bad.
In fact, there are quite a few medicines which are used for their side effects, like antihistaminics because they induce sleep. Topiramate can induce weight loss, and sometimes antidepressants can reduce migraine. So there are many side effects which are actually useful.
Most of the time, side effects are just annoyances.
Side effects tend to be mild inconveniences, and they usually wear off after the first few days. So they never really bother people actually.
When anything serious happens, we use the term adverse reaction or serious adverse reaction.
So don't confuse adverse effects with side effects. They are different. For example, liver enzymes can increase with certain medications like antitubercular medication. Non-steroidal anti-inflammatory drugs like aspirin can cause gastritis, and antibiotics can cause diarrhea.
Of course, an adverse reaction should be monitored. Medicine may have to be stopped. Your doctor is the right person to decide.
Another category is allergic drug reactions. Again, they are different from side effects. These indicate personal intolerance to a drug.
Almost 100% of the time, a drug allergy would lead to stopping the medicine. So don't ignore drug allergy. Do discuss it with your doctor.
While drug allergies are serious and not to be ignored, they are not that common. On the other hand, side effects are common, but most of the time they are not a real cause of great concern.
So my message to you is this. Side effects are like side actors. They are not the main thing, right? Sometimes they are not even serious, and many times we use medicines for the side effects, right? So don't worry about them. You can discuss with your doctor, but focus on your main effect. Are you getting them? Are you getting the benefit for which you are taking the medicine, right? And if there is any allergy, definitely don't continue the medicine at that time. Just go to your doctor and talk about it, right? So this was the message, and I hope I helped you, and see you again in the next video.